joining us on this set, and also to discuss about this very important issue that is blood pressure and hypertension.
Thank you very much.
Now, most affected individuals or Kenyans are people or young people from the age or under the age of 40 years. I want to know from you, is this true? And what are the telltale signs that one has a cardiovascular infection, so to speak?
First of all, thank you very much for inviting me to discuss this important topic. It's also the right time because during this month we'll be having the World Heart Day, which will be celebrated on 29th of September. Right. So this is a good opportunity to discuss hypertension. Coming to your question, I think the information about the most affected people being the age below 40, probably that's not exactly true. I would like to emphasize that the biggest driver of hypertension or elevated blood pressure is age, and therefore the most affected are going to be elderly people, usually beyond the age of, for men, beyond the age of 55, 60 years. Those are the people who are most affected. Yes. When can you tell that you have a cardiovascular infection, or your blood pressure is low or high? Yes, first of all, let me correct you. Cardiovascular is not an infection. These are non-communicable diseases, so we do not talk of cardiovascular infection. However, most of cardiovascular diseases, or including hypertension, unfortunately, they will not have symptoms. So most of the time, our patients will not know they have a cardiovascular problem until it is too late. However, some of the small telltale signs that they might see would be fatigue, shortness of breath. Some might come with leg swellings. Some will have a cough. So the symptoms for cardiovascular disease are quite broad. For hypertension on its own, there are no symptoms. There are no symptoms for hypertension. We have a lot of our patients who come with very elevated blood pressure and they have no signs. There is a misnomer that hypertension causes headache. Right. So majority of people with headache, they think they have hypertension. But as far as we do know, hypertension does not necessarily cause headache.
Our reporter, Gloria Milimu, mentioned non-modifiable factors that lead to hypertension, including age, sex, race, and family history. Could you expound on this?
Yes. Hypertension, we have two types of hypertension. We have what we call primary hypertension or essential hypertension. This is the majority of our patients, actually 95% of our patients will have primary hypertension, or in other words, there is no cause, there is no particular cause to this group of patients. And these are the patients who will have these what we are calling non-modifiable symptoms. This hypertension is going to be caused by age. We are saying as you grow older, your blood vessels become very narrow, sometimes become thick and rigid, and therefore blood pressure tends to rise. So age you cannot modify, that we call it non-modifiable. Race is another case. We know black people, Africans are more likely to have hypertension. Right. Again, you cannot modify your race. We do know familial. We know there is some genetic aspect in hypertension. And therefore, if your father or your mother has hypertension, some people in the family are likely to have hypertension. Again, you cannot modify where you are born. Right. So that is what we are calling non-modifiable. You cannot change your race. You cannot change your family. Okay. You cannot change many other things. All right.
Point taken. Medical experts also say that half of Kenyans do go for checkup or do tests for blood pressure. You've come with a gadget here. I want you to tell us, can you own this gadget and can you do the tests on your own?
Yes, very true. Today, actually, we are encouraging our patients, we are encouraging Kenyans, for those who can afford. We have a lot of these gadgets, which they are not very expensive. There is what we call home-based blood pressure monitoring. In fact, when you come to a hospital and you find your pressure is slightly elevated, we have what we call white coat hypertension. So some people do, their blood pressure will be found to be elevated because you are in front of a doctor. And therefore, we cannot conclude that your blood pressure, you are hypertensive. So for this patient, we actually tell them to do home-based monitoring. Right. So they can have a gadget like this. It's quite easy to use, and therefore, it should be readily, with the patient, people should be free to use them. However, the only problem, and I would like to, of course, warn our patients, when you're having this gadget, patients tend to be very anxious. Once they measure their blood pressure, sometimes they find it is slightly elevated. We do not take the first reading. Take the first, second, and third. And sometimes we ask for average. Otherwise, patients tend to panic. Once they see the number is high, once you panic, the number goes even higher. So we have found some of the patients who are keeping these machines at home, they'll keep on calling the doctor. The BP is high. BP is high. Just because of the anxiety.
They need to relax.
Exactly. They need to relax.
Okay. Dr. Bernard Gitura, we are out of time. He's a cardiologist, and now you know about hypertension. And that's why on Have Your Say, we are quickly asking you this question. What can be done to reduce hypertension cases in the country? What do you think